So Elizabeth Warren recently made an appearance on the the Stephen Colbert show, his talk show thing that he took over for David Letterman a while back, and so he had, he was on there. I'm sorry, he had his show, and Elizabeth Warren made an appearance, and obviously they spoke about policy and where she is on different her different views on things and stuff. So she was asked about the possibility of raising taxes on the middle class, specifically to fund Medicare-For-All. So she was asked about this, and then she gave, frankly, a really terrible answer. But let's watch this, and then we'll talk about it on the other side.
We're here with presidential candidate Senator Elizabeth Warren. When I say you look back, I don't mean that you're backward thinking. I'm trying to say that there were certain things that were gained in the 20th century that you are proposing that we go back to, that people are calling radical, but they used to be taken for granted.
Yeah.
The most radical thing that you are proposing is Medicare-For-All.
Uh-huh.
Okay.
You think that's the most radical? I kind of like the 2-cent wealth tax myself. But yeah, I like them all. I'll take them all. But I'm big on Medicare-For-All.
I think the 2-cent wealth tax is nothing compared to the 90% top tax bracket that was during the Eisenhower administration.
Yeah.
So that's not as radical as that was before. But there hasn't been Medicare-For-All before. You keep being asked in the debates, how are you going to pay for it? Are you going to raise the middle class taxes?
Right.
How are you going to pay for it? Are you going to raise the middle class taxes?
So here's how we're going to do this. Costs are going to go up for the wealthiest Americans, for big corporations.
Taxes, what do you mean by cost?
Yeah. Okay. And hard-working middle-class families are going to see their costs go down.
But will their taxes go up?
Well, but here's the thing.
Here's the thing. I've listened to these answers a few times before, and I just want to make a parallel suggestion for you about how you might defend the taxes that perhaps you're not mentioning in your sentence. Isn't Medicare for all like public school?
So, actually,
there might be taxes for it, but you certainly save a lot of money on sending your kids to school. And do you want to live in a world where kids aren't educated? Do you want to live in a world where your fellow citizens are dying, even if it costs a little bit of money?
So I accept your point, and I believe in your point. Healthcare is a basic human right. We fight for basic human rights, and that's Medicare for all. Everyone gets covered. But here's how I look at it. I've spent a big chunk of my career studying why families go broke. And a big reason that families go broke is health care. And even today, people with insurance are going broke over a bad medical diagnosis. And people are getting stretched financially. Why? Well, first you've got high premiums. And then you've got that copay. You need to go to the doctor, you're going to have to do a copay. Oh, and for the insurance company says, I'm sorry, we're not going to cover that doctor, not in network. And then for the specialist you need to see, that the insurance company says, no, you don't need to see the specialist. And for the extra physical therapy, and for going to the pharmacy, and that drug is not covered, and this one has a high copay. Families are paying and paying and paying. And a big part of the reason they're paying is because the insurance companies have set up their business model. And their model is rake in as much money as you can in premiums, and then say no as often as you can to health care coverage. And the consequence of that is they pulled $23 billion out of the system last year. They imposed costs on everyone else with all the forms that had to be filled out and people arguing over could they get this covered or that covered. This is not a sustainable healthcare system. I am so deeply grateful to President Obama, who moved this country to say, we as a country want every person here to have health care coverage. And now it's time to take the next step and say, let's do that in the most effective way possible. And what every study shows is that Medicare for all is the cheapest way to do that, and it's the way to make sure that those who have more will pay more, but that hard-working families will pay less. Nobody has to go bankrupt over health care if we get Medicare for all.
So, credit to Stephen Colbert. He actually pushed Elizabeth Warren pretty hard there. That was actually a better job than I've seen a lot of journalists, quote-unquote journalists, do. And he asked her, And first of all, the whole praise of Obamacare and President Obama did this, President Obama did that, so annoying. I can't stand hearing that. President Obama doesn't believe in getting every American quality healthcare. When did President Obama do that? He didn't even do that. All he did was he still, I mean, okay, Obamacare, first of all, Obamacare was a terrible right-wing policy that was implemented by Mitt Romney in Massachusetts, among other Republicans pushing for it, and Richard Nixon advocating for it and stuff. So don't give me this bullshit about how Obamacare is so fucking wonderful and President Obama believed in giving all Americans healthcare. That's a tired talking point, and I'm sick of hearing about it. But when it comes to him supposedly wanting to give all Americans healthcare, we still have 20 million people who don't have healthcare. 20 million people. That's a lot of people. We have 330, upwards of 330 million Americans in this country, and you're telling me that 20 million people not being covered is that's wonderful. President Obama, totally left. He gave healthcare to over 300 million people, but yet we still have 20 million people who don't have healthcare. Like, that's not a good thing. That's ridiculous. And so she's just doing her typical tap dance about praising Obama and trying to. That's her way. That's the way of these politicians, because they all do it too. But that's their way of kissing the ass of Obama and pretending and kissing the ass of the establishment, because this Obamacare legislation, which is a huge giveaway to the insurance companies, by the way, which people like Elizabeth Warren doesn't want to admit, but and doesn't go far enough, because it was only a tiny baby step forward. But she just wants to give credit to the establishment for doing something that honestly, even a Republican did it. Like I said, Mitt Romney did it, as governor. Richard Nixon did it when he was, or at least he came up with it, and kind of he put forth some sort of similar plan. And the Heritage Foundation was pushing crafted policy papers around and stuff. So stop praising Obama for something that even Republicans are doing. So that's stupid. I'm not going to even entertain or accept that argument. But look at what she did, though. Look at her tap dance around not wanting to answer that question. So Stephen Colbert asks her directly, are you going to raise taxes? But no, let me give it to you in this other way. This is how I look at it based on the many years that I've studied this issue. Like, dude, you know how you answer that? You say, yes, I'm going to raise taxes on the middle class. You know what that's also going to do? The Medicare-For-All is going to raise taxes on the middle class, but it's also going to take away co-pays, it's going to take away premiums, and it's going to take away deductibles. People won't have to pay for those three things, and it's going to be countered. It's going to be balanced out by the higher taxes you're going to pay, and you're going to get great quality health care. So you don't have to pay for. How many hundreds of thousands of millions of dollars people spend on? I'm not saying each person, but I'm like, as a total. How many millions of dollars people spend in this country on those three things, on deductibles, copays, and premiums? It's ridiculous. And of course, there should be a way to balance that out. And you have to raise taxes. And if you're not going to raise taxes on the middle class, which, by the way, is not going to be a huge amount, but trust me, it's going to be enough to save your fucking life. People are going to be willing to take that shot in the arm. If they have to do that, it's going to be a hell of a lot better than having to pay tons of money in not just those premiums, copays, and deductibles, which, by the way, the Bernie Sanders campaign is calling a tax, which it is. But they're not going to have to deal with the overall medical costs, because you know how much money it costs for healthcare in Canada? $0. You know how much money it costs for healthcare in Europe? $0. Scandinavia? $0. People, unless they're getting some sort of ridiculously complicated world-renowned surgery, then they don't need to spend a ton of money on the kind of healthcare that they get. If they're just going out, I need to get physical therapy for something. I need to go and get treatment for my cancer. I need to go get like a simple knee surgery, right, or elbow surgery or something like that. People in all those countries, Europe, Scandinavia, Canada, UK, all those, they don't need to pay the amount of money that the ridiculous amount of money that is spent in this country, because it's all funded by tax dollars, and it's all funded by the people that pay their taxes, and then it goes to a just cause. Now, if you want to have a conversation about how I don't trust the government doing, using my money adequately and in the right way and in a moral way, that's a different story. That's a different conversation you can have, and you can get into the details of that, and you can have a conversation about it. That's fine. That's a perfectly legitimate thing to worry about. But if you have people in there that are, going to be running this country, and they're going to be doing it responsibly, then you can trust them. So I trust Bernie Sanders to raise the taxes of the middle class, like myself, middle, upper class, whatever, lower class. Not the lower class, more of the middle class, and obviously the rich too, by the way. The rich are going to be paying much higher in taxes as well. They're going to be paying much higher taxes than the middle class will, by the way. But I trust Bernie Sanders to tax the middle class a little bit, and the wealthy a lot more, and allocate that money, correctly and in the right ways to help people that need it. Do I trust Donald Trump to do that? No. Do I trust, did I trust Barack Obama to do that? Would I have trusted Hillary Clinton to do that? No, I don't. Because I don't think that they truly believe in those things, because they don't. And I know that Bernie Sanders believes in it, and he's a moral person, and he believes in pushing for these things and making sure that people get out of these programs what they need. So to expand on this kind of whole thing with Elizabeth Warren and how she responds to these questions, she has a history of not responding to these questions very well. And just in this last debate that we had, I think it was September 3rd, when was it? September 12th? September 11th? September 12th, I think. Yeah, September 12th, which was the 10 Democratic candidates, because the 10 others couldn't make it. So it was just whittled down to 10 candidates, which included Bernie and Biden and Warren and Klobuchar and Yang and Beto and Buttigieg and stuff, and the rest of them. And so Elizabeth Warren was asked basically the same exact question. So this was, I think, maybe 20 or 30 minutes into the debate, because the first topic was healthcare, and then they discussed this. So she was pressed on this matter. So why don't you guys check out this clip? It's about a 2 or 3 minute clip of her responding to a similar question asked of her by debate moderator George Stephanopoulos. Check it out, and we'll talk about it on the other side.
Senator Warren, let me take that to you, particularly on what Senator Biden was saying there about health care. He's actually praised Bernie Sanders for being candid about his health care plan. That Senator Sanders has been candid about the fact that middle-class taxes are going to go up and most of private insurance is going to be eliminated. Will you make that same admission?
So let's be clear about health care, and let's actually start where Vice President did. We all owe a huge debt to President Obama, who fundamentally transformed healthcare in America and committed this country to healthcare for every human being. And now the question is, how best can we improve on it? And I believe the best way we can do that is we make sure that everybody gets covered by healthcare at the lowest possible cost. How do we pay for it? We pay for it. Those at the very top, the richest individuals and the biggest corporations, are going to pay more. And middle-class families are going to pay less. That's how this is going to work.
Direct question. You said middle-class families are going to pay less, but will middle-class taxes go up to pay for the program? I know you believe that the deductibles and the premiums will go down. Will middle-class taxes go up? Will private insurance be eliminated?
Look, what families have to deal with is cost, total cost. That's what they have to deal with. And understand, families are paying for their health care today. Families pay every time an insurance company says, sorry, you can't see that specialist. Every time an insurance company says, sorry, that doctor is out of network. Sorry, we are not covering that prescription. Families are paying every time they don't get a prescription filled because they can't pay for it. They don't have a lump checked out because they can't afford the copay. What we're talking about here is what's going to happen in families' pockets, what's going to happen in their budgets. And the answer is on Medicare-For-All. Costs are going to go up for wealthier individuals, and costs are going to go up for giant corporations. But for hardworking families across this country, costs are going to go down, and that's how it should work under Medicare-For-All in our healthcare system.
Jesus Christ, just answer the fucking question. What is so hard about answer? Just say yes. Yes, we are going to raise taxes on the middle class because they're going to pay less in co-pays, premiums, and deductibles. Even George Stephanopoulos lobbed her a softball there. He even admitted, he says, yeah, I know you believe that co-pays and deductibles are going to go down. So he's even saying that to her. And she still doesn't respond by saying, yes, that's what's going to happen. And then she goes into her typical stump speech. Again, she mentions Obama for the fucking millionth time. All the other Democrats are doing the same shit too. Again, she mentions Obama. God damn it, stop mentioning Obama so much. He didn't fundamentally transform the system. The system's the same. It just, the only difference is that the insurance companies are, well, at least under the Obama, because Trump took it away, but the insurance companies were mandated to cover more Americans, but they only ended up covering 30 million more Americans. How's that transforming the system? Stop saying that. It's so stupid. But look at her. She goes into her typical stump speech, dances around the question of from actually responding to the whole, idea of raising taxes on the middle class, and then she just repeats the same talking about so American, just like she did on Colbert's show. Yeah, American families are suffering with this, suffering with that. Yeah, we know. Bernie Sanders has been saying that. Why do you keep? That's fine. Like, it's fine to mention that. I'm not against her mentioning that, but I'm saying, like, if you're getting a question directly, Stephanopoulos even said, I'm asking you directly. You get a direct question about whether or not you're going to raise taxes, you have to respond. Because what's going to happen if she goes into a debate? Let's just say Elizabeth Warren is the nominee. Is the nominee against, Democratic nominee, and then ends up facing Trump? What if she goes into that first debate against Trump? What's Trump going to bounce on? He's going to say, "Oh, so are you going to raise taxes or not? Are you going to do it? You're going to raise taxes, right?" But then, so how is she going to respond? Oh, the cost is really important. Yeah, we don't only have to worry about the cost, the whole cost. Okay, but she's not getting into the details, though. So if you get into the details of those, again, like I said, the co-pays, premiums, and deductibles, which are a tax, those are taxes. They're not technically taxes, but they're extra charge, which our taxes are. Those are considered a tax, and they're being portrayed as a tax by the Sanders Sanders campaign, but she's not doing it. But what's Trump going to do? He's going to say, oh, okay, so you're admitting that you're going to raise taxes on the, you're going to raise taxes on middle class people. But then if you actually counter it with mentioning the co-pays, premiums, and deductibles, then people can be like, oh, okay, I see what she wants to do, or he wants to do, whoever says it, whoever the candidate is. I see what they're trying to say. They're trying to say that it's going to be balanced out, those me paying higher in taxes, me as a middle class person paying higher in taxes, it's okay because I'm not going to have to pay any more co-pays, premiums, and deductibles. So that's a good thing. And that's something that people, if they're smart, they're going to know. As long as you can slam that point home multiple times, repeat it multiple times, people are going to get it. Eventually, it's going to get into their heads. But if you're Elizabeth Warren, what do? You don't do that. You just go into your stump speech about how people are suffering, how people are not, are not able to handle their costs and blah, blah, blah. Yeah, we know that. That's a great, thank you for mentioning that. That's wonderful. But you have to get into details. You can't just keep repeating the same shit. Again, she said the same exact thing in the Colbert segment. Same exact thing, same exact dance, same exact talking points. And you can tell that she's practiced these talking points. She's practiced these things. Her advisors and whatever consultants and all those idiots that basically fucked it up for Hillary Clinton are continuing to fuck it up for Elizabeth Warren too, because they don't want her to admit that they don't want her to, well, she or them don't want to admit that the obviously co-pays, premiums, and deductibles are going to go down, because that's not what's going to happen. So basically the point is she doesn't believe in Medicare-For-All. Because if she truly believed in that, she would have said that. She would have said exactly what I've said multiple times in this segment. You get rid of the co-pays, premiums, and deductibles, and you raise taxes on the middle class. That's it. Because those three things affect regular middle class people. If you believe in Medicare-For-All, you push that talking point. You push that. You say that. It's not hard. You just put that out there and you say it. And then people will be like, oh, okay, I get it now. But that's the thing. Somebody like Elizabeth Warren, she thinks her and the people that consult her, they think everybody's an idiot, and they think everybody's too stupid to not look past the talking points. And I guarantee regular independent voters, the people that are going to swing back and forth between Republicans and Democrats, they look at this and they say, oh, this is this elitist white lady here, this bourgeois, it's like a bougie. It's like another way of saying bougie white person, basically. these kind of people, these elitist, bougie white people, are coming out here and trying to play me off like a fool. They're trying to pretend like I'm an idiot, and I can't understand when they tell me that they're going to raise my taxes. Now, again, they don't know about the premiums and deductibles and copays being taken away. But so when you don't say that part, and you say, yeah, we're going to raise taxes, but then she doesn't fully admit it, and she says, "Oh yeah, well the rich are going to pay more," and then the cost of the people that are paying so much in healthcare is really, really bad. Blah blah. She just gets into these whole stupid stump speeches that don't have anything to do with anything, and it's just she doesn't believe in it. And I'm going to get into another segment soon talking about this similar type of issue about where she doesn't truly believe in Medicare for all, but we'll get into more detail, and this is going to be more of a focus on her supporters, kind of the outlook of her supporters and how they frame this debate. But yeah, she clearly doesn't believe in Medicare for all. This is not something that she's going to push for. It's not something that she's going to be passionate about, and I just don't believe that she's going to do it. And it's just, based on these multiple times where she's made public appearances on TV and in debates, she's obviously not able to put out the right talking points, and she constantly fumbles and bumbles and mumbles all over her words, and she can't, and she constantly just resorts to her talking points that her advisors and consultants give to her, and that's something that people can't stand about politicians, and Elizabeth Warren is demonstrating that perfectly for everyone on national television multiple times, and we're up to her. We're catching on to her games, and they're not convincing anybody.